I'm doing well. How about yourself?
Good, good. I was waiting for my jingle, but it didn't play.
It didn't play,
anyway.
right? You're on now. We're both on.
Okay, thank you, Mr. B. Thank you. Hey, so this is an important show. Now, are you a doctor, Matthew?
Yes, I'm a cardiologist, heart doctor.
Oh, you're a cardiologist. Splendid. You know, I've heard a lot of things for a lot of years about the positive attributes of garlic. Have you written a book on this, or how did you end up being booked on my show about garlic? Because I find this very interesting, and I'm very excited to have you on, sincerely.
Yes, I've done a lot of research. I did research on what's called aged garlic extract, which is a product called Kyolic, and basically I've done a number of studies that shows that it slows down or even reverses heart disease. So because of that, I've been trying to talk about it and spread the news about our results that we've been able to publish.
Wonderful, because matter of fact, I'll go into an Italian restaurant and I'll ask them to take fresh garlic, slice it, and to simmer it in olive oil until it becomes translucent with a little bit of brown around its edges. And I'm talking like a quarter of a cup. I mean, and I put it on my spaghetti sauce. And every time that I do this, I don't know what's going on, but I look down at my chest the next day, and I know something good is going on. I don't know. Yeah, I don't know what it is, but it seems to work.
Yeah, well, garlic has been around forever, and it was a performance enhancer back in the ancient Greek Olympics thousands of years ago. So maybe you're getting some of those benefits from the garlic. It's also part of our, a big part of our Mediterranean diet, which has been shown that helps make people live longer. So I think there are some, very prominent parts of garlic that may be playing a role in what you're feeling.
Huh. Well, I want you to know how important this interview actually is for me today. I'm home in my sick bed. I canceled all other interviews for live broadcast today except yours. So that's how much I legitimately am concerned. I just have a sore throat. I've had it 4 days. But, it's funny, you're a cardiologist, because just last night, the reason I used to have a cardiologist that sponsored my show years ago, and I woke up with a terrible ache in my jaw, and I did my show for 4 hours with this ache in my jaw, and then I got a phone call from the sheriff that a local famous writer had died because he had an ache in his jaw, an older guy, and went into the hospital on Friday night thinking it was a tooth. And I got to say, last night I had that aching in my jaw again. It really worried me until I took some Topril and Topril and Norvasc. But it's funny, I was talking to a cardiologist, and do you want to comment? It's just, a lot of people don't know that an ache in the jaw can be a telltale sign of a problem with your heart, right? Blood pressure?
Absolutely. Could be blood pressure, could be your heart itself. So the jaw, the left arm, or the left chest are the most common places where you might feel heart pain. And especially if you have things like diabetes or high blood pressure or high cholesterol, you're predisposed to having these type of problems. So you don't want to dismiss it lightly. If it doesn't go away, if it continues to build up in intensity, then definitely, either go to the healthcare professional or go to the emergency room, or if it's getting really severe, even call 911 and let the paramedics check you out before it's too late. Because if it's a heart attack, it's damaging the muscle of the heart, and that could kill you.
Wow. Because I've been, I'm scared that this is COVID. I don't think it's COVID, but I've been worried, so I've been taking a lot of zinc and some of that. What's that stuff that you go to sleep with?
Melatonin or
I've been taking melatonin.
Magnesium.
Yeah. No.
Yeah, zinc is excellent. Vitamin D is very important for COVID. And there's actually been some now studies of both fish oils and garlic helping with COVID. So there are some supplements that people can take to help protect themselves. These are the COVID is inflammation. It causes like this crazy amount of inflammation in the body, and we've shown that Kyolic blocks inflammation. And there's been a recent study with fish oils that actually shows that it helps in patients with mild COVID symptoms. So I always recommend vitamin D, zinc, as well as fish oil and garlic for patients who have or are at high risk of getting COVID. Let's say they've been exposed or something, and they want to, try to block it before it gets serious.
So get out the sardines and the tuna fish, right?
There you go.
Now let's talk about your garlic. Now I presume that there's a company that's providing your services to talk to me, and that there's some sort of a product you're promoting. Am I right? Or
well, it's the research that I've done. I'm part of UCLA, and the research that I've done randomized trials with is called Kyolic, Kyolic. So they're the ones who have been sponsoring some of the research. The research was done independently of them, but they were the sponsors and provided me the drug and all of that, so I could do the trials.
Okay, so where do we get this? Do we have to special order it, or is this available on our regular supermarket shelves?
No, it should be widely available. Health food stores, many supermarkets. It's also known as aged garlic extract because they age it so that it becomes odorless, and that's nice because then you don't kind of upset your significant other by smelling like garlic. So it's a truly odorless formulation. And you can also just go to their website, kyolic.com, and get and they have a finder where you can find the nearest place that sells it. It's not, they don't sell it online, they sell it through different companies. So they're trying to help promote some of the smaller businesses and larger businesses that distribute their product.
So are you doing this out of the goodness of your heart, or you're involved in the investment of all this? You're doing research yourself?
No, I'm not involved. I don't have any financial interest. I did the research, and they funded some of my research. So in return, I try to just let people know what the research showed. I've tried to I talk about a bunch of different health things, but one of them that I'm a believer of now is this aged garlic, because I've seen the benefits in a number of my patients, as well as in 5 clinical trials now. We've done 5 randomized studies.
Now, you said aged, so this is old garlic? Does it have mold growth?
No, they age it for about 90 to 120 days to get rid of some of the oxidants and some of the toxins. So it's kind of like what you do with, grapes, turning it to wine. They take raw garlic and turn it into this refined garlic.
Huh. And then it sits on a shelf? Does it become aged, or
yes.
It becomes aged before?
Yes. Then it's packaged into capsules or liquid, and then it's sold. And once it's aged and refined, it's packaged. I mean, in Japan, where it's originally from, the stuff that we get in the U.S. is made in Riverside, California. But in Japan, where they developed it, it was actually treated as a drug, as a regulated drug. So they went through a lot of research to formulate this, and it's formulated under very strict conditions. So it's treated, in other countries sometimes like a prescription therapy almost, as compared to what we do in the United States with our dietary supplements.
Wow, it sounds like you're on the cutting edge. What else are you involved with at foods that we should ingest for our good health?
Well, as a cardiologist, I'm a big proponent of fish oil, especially the omega-3s and EPA as one of the primary ones. But I do think that, especially now, with COVID in keeping us kind of out of gyms and out of public forums more, we need to figure out a way to exercise. I mean, it's not really a supplement, but it's really important for our health, is to get out and figure out some way to exercise, whether it's a home treadmill or whether it's taking a walk, depending on where you live, or jogging or whatever you can do. You need to get a little bit of heart health because being sedentary is going to really weigh poorly on your long-term health.
Now, I don't know where you live in L.A., but we all know that L.A. is famous for its smog. Now, do you get out yourself? Where do you live in L.A., if you don't mind my asking? I mean, not specifically, but which section?
Oh, I'm in the south. I live in what's called the South Bay of Los Angeles, so just south of LAX, of the airport.
Okay, so when I'm going across, I live in Vero Beach, Florida, and that's where we're initiating this broadcast. I'm next to a bridge. It's called the Barber Bridge. But there's as I'm walking over that bridge to get exercise, there's a whole lot of trucks and cars going over it. Isn't that a bad place for me to be walking because I'm breathing in all the stuff that those vehicles are exhaling from their engines?
Yeah, I mean, I think it'd be nice to find if you could find a park or something that's a little more away from some of the high flow traffic. Certainly walking is great, and remember the heart is a muscle, so the only way to exercise the heart is to do aerobic type exercise. So whether that's jumping jacks or walking upstairs or taking a walk, you need to get that heart pumping a little bit for about 20 minutes 3 times a week at a minimum.
So it's 20 minutes 3 times a week, and you will be in good shape. You may not be thin or losing weight, but your body will be in good shape with just mere 20 minutes 3 times a week.
Yes, that's what the recommendation is for the minimum amount of exercise that we should be doing on a regular basis to promote long-term health. And remember, it helps not only your heart, it helps your joints, it helps your brain. People who exercise have better brain function later in life. So it helps stave off some of the Alzheimer's and dementia and other problems that people get. So those people who are more prone to exercise and taking walks have a better and longer, healthier life in general.
I got to tell you something, Dr. Matthew Budoff, that I have a friend. He's 94 years of age. And he was a little plump. He started exercising and getting in shape and eating the right things at the age of 70. He started his real estate firm at 80. He's now 94. He runs his real estate firm, and he has a radio show on my station once a week, plus he co-hosts with me on Fridays. And his clarity of thinking is better than some of the 60, 70-year-olds that I know. It's amazing.
Yeah, no, I have a couple patients like that as well, and it's just always remarkable to me. But it are these people who walk and get out there and exercise, and rather than what happens as we get older more naturally, as we start getting more sedentary and we sit in front of a TV and sit in our armchair, and our joints degrade and our brain degrades, and we just get weaker and weaker.
And there's really no excuse. I ran into an older man. He was 96 years of age 3 years ago. I believe he's still alive. And he said he sat there and he would move his arms, but he would exercise for a half an hour, even if he was seated, by moving the legs, moving the arms, and that this is what's kept him alive so long. Now, I want to ask you something. I don't know what Budoff is. I don't know what is
originally it was Budanov. It was a Russian name, Russian descent.
Okay, Jewish Russian, or?
Yep.
Okay, great. Half my family's Jewish. They live up in. They were used to live in Santa Monica. But anyway, I wanted to bring in the Bible. Now, this is the New Testament, of course. In the book of Revelation, somewhere, I read when I was younger that it says, "In the end times, the leaves of the trees will be healing to the nations. The leaves of the trees will be healing to the nations." And it does seem that there's a natural remedy for all our ailments out there. And you're the one that's been doing this, getting some help from these companies to do this investigative work that you do. Would you agree that there's a natural remedy out there for almost everything?
Yeah, no, I'm very convinced that we haven't explored them very well, but the ancient cultures have been surviving for forever, using a lot of these natural formulations that they find. And a lot of the things that we use in our medicine, even these pills that you take, are derived from plants. There's many examples of a lot of these things they're just purified and then manufactured rather than harvested from plants anymore, but they were derived from the plants themselves. And that's probably how a lot of these older cultures have survived for so long and thrived.
Yeah, it's amazing. Now, let's get back to your garlic today. I want to ask you, how much garlic should one ingest on a daily or a weekly basis in order to have great health?
Yeah, it's a little hard with natural garlic to get an exact number because it probably depends on how you prepare it, whether you slice it or whether you cook it into food or whether you eat it raw. But I would say that you probably need a good amount of garlic per day, and that's why I often advocate that people supplement their garlic intake with a little bit of the aged garlic extract just to have enough so that they're not walking around smelling like a clove of garlic all the time. One of the benefits of COVID is people are wearing a mask, so maybe it's not quite as offensive, but still, you could get a pretty robust smell from eating too much garlic. And a lot of people can't tolerate a lot of raw garlic. If you eat a lot of garlic, cooked or raw, some people have a really upset stomach, and it's not that well tolerated. So that's the nice thing about this aged garlic is that it's a lot smoother, if you will, and a lot easier to tolerate.
Oh, is it? Huh. So, I remember I was dating a girl years ago, and I had garlic, and we were watching a movie, and she went, phew, and I'd had, I guess, a spaghetti or something, but anyway, I went back into the kitchen, and I popped some popcorn, and then unbeknownst to her, I sprinkled a little garlic salt on the popcorn. Later on, she goes, "Oh, your garlic breath disappeared." So in other words, she had the same garlic bread now, and when both people have had garlic, it doesn't bother the other person, right?
Right.
It's a funny thing. I mean, you've studied garlic because you see garlic used throughout history to ward off demonic spirits, etc. It's been pretty crazy that they've attributed a lot. It's always been known as a health remedy, has it not, historically?
Yes, absolutely. Yeah, it's been around for centuries.
Wow. Okay.
Millennia.
You have a website that you want to promote, Doctor?
If they want to learn more about my preventive work, it's called calciumscan.com. It's all one word, calcium scan. We do these heart scans to look at preventive health. And if they want to learn more about garlic and some of the research that we've done with aged garlic extract, then it's kyolic.com, KYOLIC.com.
All right, and I apologize. This has been a little unusual. I'm doing this literally from my sick bed. I've had this sore throat for 4 days. But it was so important that I was willing to call in the studio just to do this one interview today because I think the attributes of garlic are amazing. One final question I want to ask is this. When I go into a restaurant and I ask them to slice fresh garlic as opposed to that jarred, pre-cut up garlic, so it's fresh garlic, and then I ask them to saute it until it's translucent with a little bit of a brown edge around it, am I hurting the medicinal properties of it by sautéing it, or no?
Probably not. We just don't know enough exactly because we haven't tested it in all the different varieties that garlic can be served. But I think if it's slightly sautéed or it's probably not going to lose a lot of its medicinal properties. I think if it's but you just need a lot of it, and you need a lot of it regularly. That's the problem.
Oh, well, thank you, Dr. Matthew Budoff. I appreciate you taking time out of your schedule to be with us.
It's a pleasure. You have a great day.
You too.